Welcome to the second session for the Putting Public Health Evidence in Action to Prevent and Control Cancer training. Today we're going to talk about how we can collect data to better understand our problem and then use that data and that information that we collected to establish our goals for improvement. So just a quick reminder for any CPCRN scholars in the audience, please add your name to the chat just so we can get a head count. So today, as I mentioned, we'll talk about determining our current performance, and then we'll also identify multi-level factors, or we'll talk about how to identify multi-level factors that contribute to a problem, and then we'll learn some new tools that we can use to both engage our stakeholders and identify weak links in a process, such as a process map or a gap analysis. And last, we'll talk about how we can establish our improvement aims and objectives. So we are going to use colorectal cancer screening as an example in today's training. One way that you might determine the current performance for colorectal cancer screening is to determine your screening rates. So for my example, if I were to determine my current colorectal cancer screening rates, I would need to identify patients aged 45 to 74 with at least one clinic visit in the past year, not including any patients who have or had colorectal cancer in the past. So these would be my active patients who are eligible for screening and will be my denominator. Next, I need to identify patients who have received screening before, either in the form of an IFOBT or FIT in the last year, flexible sigmoidoscopy in the last 5 years, or colonoscopy in the last 10 years. And this number will be your numerator in the equation below. You'll divide that number by the number of active eligible patients for screening to get your CRC screening rate. So if I were to look up my rates and determine that they were perhaps lower than average, I might decide that that's an area that I want to learn more about. So the next step will be to conduct some research looking into why my rates might be low. So you can do this by reviewing the literature and existing data, or collecting new data and gathering stakeholder input, as well as by mapping your current process. As you investigate factors that may be affecting your rates, pay attention to where they fit on the social ecological model that we introduced in the first model, or in the first session. So here is that model again. Mapping the factors to the appropriate level in the social ecological model can help you to understand the dynamic interrelations between multiple factors, and it can help you think through ways that you can implement an evidence-based intervention that can actually target these contributing factors on each level. So we'll come back to this model again later in this session. We're now going to talk about some potential sources for data that can help you with your assessment. I've listed some here, and I'll go over 2 specific resources more in depth today. And while I don't have time to review all of them with you, yesterday we did send out a comprehensive list of data sources and resources. So as you have time, you can take a look at some of those. And there are also some resources on there that we'll use later in later sessions during the training as well. So here on my slide on the left are some examples of general health and demographic data sources, such as the US Census or the Morbidity and Mortality Weekly Reports. And on the right side, I have data sources that are more specific to cancer screening and vaccination, such as sources from the CDC and the American Cancer Society. You may also want to search for data that's specific to your hospital or healthcare system, depending on what you're researching. So here are some sources of data that you might use for that, such as electronic health records or the Rural Health Information Hub. Can you think of any other sources that you would include? If you can think of something that we missed, please add your go-to data sources in the chat so we all can see. And I'll call any out if I see any, but I haven't seen any yet in the chat yet. That's okay. Let's see. So now I'm going to walk you through a resource called the Cancer Control Planet. And we're going to use this resource to find the colorectal cancer incident rate in your state, or in this example, I'm going to use Minnesota, my home state. So this is the home page of the resource once you get to the website. And from here, what we'll do is we'll click on the state cancer profiles, which is under the data section on that page. So that will take you to this page, and pay attention because I'm going to have you do this on your own afterwards. So this, once you click that, it'll take you to this page where you can click on a state on this map to see the full cancer statistic profile, or you can click on a specific type of data. So for this example, I'll click on incidence. And that will take you to this page where you can decide to make an interactive map, a table, or historic trends. Let's do an interactive map. So clicking on the interactive map will give you an option to further sort the data that you want to see, maybe by state or by county or type of cancer. You can look for a certain type of data like incident rate or mortality rate, or other variables like race, ethnicity, sex, age, and year before generating your map. So this is what I decided to choose by the cancer rates by state and colon cancer incidence rates. So then I will generate my map, and this is what I see. And so this is a map of the colon cancer incidence rates in the United States. And you can click, when you create this map through your browser, you can actually hover over each one of these states to get the full rate. And one thing you might find when you're looking for data and making maps on this website is that they don't always have all data for every state or all data for every county. And so you might want to look at the state cancer registries for more current and more local data if you can't find what you need here. And I'll also point out that by clicking the tab up here on the top that says data table, you can see this same data in a table instead of a map. Okay, so it's your turn now. I want you to navigate to the page, the Cancer Control Planet. It's linked in your resource list, but I also made a short link here so you can type it in, and I can type it into the chat for you too. Let me do that quick. Okay, so you should be able to copy that into your browser and then go through the steps to find your state's incidence rate for colorectal cancer. And then once you find it, send your state and the incident rate in the chat so we can see. And then we can get a sense for where you're from. I'll give you a few minutes to do that. I sent the slides last night in an email too. Let me know if you need me to send them again so you can see the instructions again if you need to. Okay, we've got Virginia, 35.2 per 100. South Carolina, 37.8 cases per 100. I will send the slides in the chat for everyone. And I'll send the data source list one more time too. Okay. Nice, we're getting more states. We have, wow, a lot of different states. Arizona, Colorado, Kentucky, Texas, Missouri, Oklahoma, North Carolina. Let's take just a couple more minutes and then we'll move on because we've got lots to cover today. Indiana, Tennessee, we almost cover every state. Georgia. Nice. Okay, I'm gonna keep moving. So another Another data source I want to show you all is called SparkMap. It's a great resource for visualizing your data. It uses location-specific data to create maps and community assessments. So let's walk through making a map. Once you click Make a Map, it will take you to the map room. And from here, you can search for the data that you want to add to your map. You can search by keyword, or you can browse by topic or browse by data source. If you browse by topic, for example, it will show you a whole bunch of different types of data, public data, health data, and you can expand these even further for more specific data and select what you'd like to add to your map. So here's just a quick example of what the map might look like. In this case, I added the colorectal cancer incidence rate to the country. And I also added access to primary care physicians and pharmacy and drugstore rates. So right now, the only layer that's turned on is the colorectal cancer incident rate, but I could turn these other layers on, and you can play with the transparency of the color to make it easier to see the various layers. And you can also export this map as a PNG image file or as a PDF to use in your assessment. If you want to create a community assessment report instead of a map, you can click the Build an Assessment button, and that will take you to where you can decide what state and county you want to create a report on. So here I picked my home state and home county. And then if you click Data Indicators at the bottom, it will take you to another page where you can select the list of indicators that you want to add to your report. And so there are a lot of indicators here. If I were to expand this demographic indicator tab or any of the others, it will bring me another list of more specific indicators within that category that I can choose, or I can simply just select all the indicators. But once you figure out what you want your report to include, you can click the report button at the bottom, and that will generate a report. And this is just a snapshot of what it might look like. Since I selected all indicators, my report's actually pages long and I'd have to scroll to show you everything. But this just shows that they lay it out really nicely for you in a table, in a graph. You can export it as a PDF file or save it as an interactive report in your SparkMap account to go back to later. And it's just a good place to start to get your initial community assessment draft figured out and get some initial data to understand what's happening in the community and why your rates may be low. So we've discussed reviewing existing data. You may also want to collect new data. And this could be in the form of interviews, focus groups, surveys, maybe even public meetings or direct observation in the community. And you want to make sure that you work with your stakeholders throughout this process, just like we talked about in the first session. Your stakeholders' in-depth knowledge of the local context is invaluable when you're designing, say, your survey instrument or your interview guide. And when considering your data collection methods, it's also important to determine things such as how many participants you will need and the best method to collect the data, as well as the resources that you'll need to do it. For example, conducting interviews can be a very resource-intensive task. You need to first create your interview guide, conduct the interviews, then you also need to transcribe, code, and analyze the interviews. And I left out a lot of steps. There's actually a lot more to it. But you might find, though, that while you don't have enough resources to do 10 interviews, you might be able to do 5 interviews. And there are also some methods that might make the analytic process a little less time-consuming, such as a style called rapid turnaround analysis. So it's important to consider your resources when you're selecting your methodology so that you can come up with something that meets both your needs for your data collection efforts, but also fits into what you have the capacity to do. This is just another slide to reiterate how important it is to gather input from your stakeholders. They may be your healthcare system or hospital partners, or your providers, staff, even patients, government agency partners, academic partners. Who are some stakeholders that you all meet with? Do you want to add some to the chat if you can think of other stakeholders that you work with? I don't see any yet, but we can come back to the chat. Because now, oh, there's a chat. community partners, community leaders, healthcare workers, absolutely, community health workers, Cancer Coalition. Yeah, those are great examples of stakeholders. Cancer Society, good. Okay, so we're now going to talk about another way that you can, it's a tool you can use to engage your stakeholders and better understand the local process. So this helpful tool is called a process map. And when you create a process map, it's good to set some time aside to meet with your stakeholders when you do this and work to map out the current process. So in this example, it's a visualization of the process as it happens, not as you would like it to happen. We call that a future state process map, which we're not going to cover today. We'll focus on the current state for now. And from there, you want to analyze your map with your team and discuss any weak links in the process, and then talk about how you can make plans for improvement. For example, teams might identify steps in the process that don't add value, or such as things like delays, unnecessary work, or duplication. Maybe something in the process is just too expensive, or there's breakdowns in communication. So it's at these points where we can start to identify areas that we can improve. So this is a template that we'll use to create a process map. It's very standard. It's from the Institute for Healthcare Improvement. In this example, the oval shape will signify the start or the end of a process, and the rectangle signifies an activity or a task within the process. And then if you get to a diamond, it represents a stopping point where you need to make a decision or answer a yes/no question that will kind of determine which direction you go on the map. And then all of these shapes are connected by the arrow or flow line to show the direction that the process kind of flows. So here is a very simplified example of a process map for colorectal cancer screening. In this example, we actually start with a question. So we have a diamond instead of an oval. And our question is whether or not a patient is eligible for screening. So because this map maps the screening process, we haven't actually included what happens if we say no, but you can certainly do that in your map. So here we have a yes, and we go right to the next step, counsel patients on CRC screening options. We keep moving along the flow until we get to this diamond, which is a yes/no question. We need to determine whether or not the patient got their colonoscopy. If they didn't, we go up to this next activity, which is to send the reminder to reschedule for the colonoscopy before we can actually scan the results in the EMR. If they did get it, we can go right to scanning the reports into the EMR. And this is a very simplified process. In a real life process map, it'll be a lot more detailed. It's good to include who is doing which step in the process, and maybe even when, and more specific details are really helpful so that you can really understand the process and identify any gaps a lot easier that way. You may also find when you're working with stakeholders in a process, or even your team members, that you identify places where not everyone had the same understanding of how the process worked. So it's good to have a discussion around it so that your team can kind of identify and come to a consensus of what the actual process is. So here is a process map from a real project that shows how complex they can get. I'm not going to go through each step here, but in your own time, you're welcome to look at it a little closer and kind of see how this map flows. But for today, we are going to try making our own process maps. So we're going to divide into 5 different breakout sessions, and we're going to work within our breakout groups to map the process for getting ready for work in the morning. We used to say map the process for going to work, but I know we don't all necessarily leave our house to go to work anymore. So just like what is the steps that it takes for you to get on maybe your first Zoom call? And so we're going to use a tool called Google Jamboard, which I'll show you how to use in a second. And on the Jamboard, you will be able to add little virtual sticky notes to your virtual whiteboard, and they'll represent different steps in the process. So on our Jamboard, our red sticky will be used to show the start or the end of the process instead of our oval. And the blue sticky is going to show the specific tasks or activities throughout the process, like our rectangle did. And the yellow sticky will be like the diamond and indicate when a decision needs to be made before you can move to the next step. And so after you've created your process map with your group, you can chat about any weak links or opportunities for improvement in your process. Like, is there something you can do to save time and get ready more efficiently? So I'm going to reshare my screen and show you how to use the Jamboard. I'm also going to send you the link to the Jamboard so you can open it in your own browser. I would refrain from making any edits to the Jamboard right away because everyone will be able to see what you do on there. So I'll show you how to do it here in a second, and then we'll divide into groups. And when we come back, I'll ask for a group to walk us through the process map they came up with. So let me send the link. It's the orange link on my slide, and I'll type it into the chat for you too. Okay, so that will take, oh, Becky sent it. Thank you, Becky. So that's the Jamboard link, and I'm going to reshare to kind of show you how to use it. Okay, can everyone see that okay? So you should be able to see the Jamboard from my screen share, but also from your browser if you went to the link. We'll use this Jamboard to map our process for getting ready for work. We're going to use the sticky note, which is the fourth icon down on the left. And when you click that, it'll open up a little window that will let you type your sticky note into the box, and you can change the color so that it can be either the red, blue, or yellow, like we talked about before. When you press save, it will be added to your map and you can move it around. You can change the size. It's kind of a lot like PowerPoint. It's pretty intuitive. You can also add fun little things like arrows if you really want to through this icon down here, or you can draw your arrows. You also can just kind of line the stickies up in order, and you don't necessarily need to use the arrows. Now, in order to get each breakout session is going to have their own blank slide. To change the slides, you just click the arrow up here, and you'll have to do that on your own browser so that you can see the slide. Nice. And so I clicked it to go to the next slide, and I have a blank practice slide here for you. So go ahead and put a sticky on the practice slide. See if you can get it to work. Maybe send us a joke if you want. But remember, everyone can see what you write. Nice. I'll move them around so everyone can see. Cool. Looks like there's quite a few stickies and people are getting the hang of it. Triangles, nice. Okay, so I want to make sure you have time for this. So let's pause our practice, or I guess you can keep adding slides on there, but I'm going to move to the next one just to show you how each breakout session has a slide for their group. I'm going to randomly assign everyone to the breakouts. There'll be 5 groups, and we'll have a co-host in each group that can help out as well. And make sure to go to the slide that matches your breakout group. Any questions before we get started? Your co-host can help too. I don't see any questions coming through. Okay, so let's maybe take about 15 minutes or so in our breakout sessions, and then I'll bring you all back and we can discuss what you found. Does anyone want to present their group's process map?
I got permission from my group to share.
Great, great. Which group are you in?
We're number 5.
Okay. There we go. Okay.
Yeah. I struggle a little bit with the arrows, so I don't have arrows in between all the boxes, but the basic gist of it is the yellow is all the things we do before a Zoom call. The green is what we do during the Zoom call. The blue is what we do immediately after the Zoom call. And then the pink is kind of like transitioning to the next Zoom call, or, you know, kind of longer term follow-up for the Zoom call.
Nice.
So that was the rationale behind our color coding. So as you can see here, lots to do in preparation for a Zoom call. I won't go through all of them, but people can see. The most important one, of course, for me is grab coffee. The green one, you know, things that people do during the call, including taking care of their dog, their COVID puppy. For the blue one, making sure we have the attendee list, the chat, recording. And the next one, I like this one, conclude and discuss targets to be achieved before next meeting. So somebody who's very thoughtful about that next step after the Zoom meeting. So it's the debrief. Yeah.
Did your group come up with any kind of area that they could improve upon or make their process more efficient?
No, we didn't get to that. I might have missed that part of the assignment. We were so busy creating the map. But,
it's beautiful. Thank you for sharing. Does anyone else want to share their group's map before we move on?
We can share group 3 or room 3.
Nice.
Although 4 is awfully neat. I'm very impressed with 4 when I see it go by. Oh, yes, that's us.
All right.
No, it isn't us.
No?
No. Go to.
This one?
No.
I think you were in 1, maybe.
Yes, 1.
Oh, that looks nice.
So this just we started with get out of bed and ended with on the computer for 8 hours. And our decision points were, do you have a dog? Do you have kids? Are you going to bother to shower this morning? And where we did start talking about where we might need to go deeper because we have lots of problems is with the kids. And that's a big area of delay and rework. Okay. So that's our flow diagram.
Great. Thanks for sharing. All right. So in the interest of time, I'm going to keep moving so I can share another tool to engage your stakeholders. So let me go back to my slides. Okay. There we are. So another tool to get stakeholder input is called a cause and effect diagram or a fishbone diagram. When you make one of these, you want to start out by writing the effect that you want to influence on the right side of your page. So in our case, we'll put our low CRC screening rates. Then you'll draw a horizontal line across the page to the left, starting at that box. From there, you'll think of 5 or 6 different categories of causes for that effect, and then draw diagonal lines above and below the horizontal lines to create fishbones. From there, you'll label each line at the end with one of the categories you've chosen. And some standard categories in a classic cause and effect diagram are materials, methods, equipment, environment, and people. So for each category, generate a list of the causes that contribute to the effect. And then you'll list those causes by drawing branch bones underneath your bigger branches. And then as necessary, you may even draw additional branches from those to show sub-causes. So if we were to make one on our own for our process for leaving the house or getting on our Zoom call, what are some barriers or facilitators in these categories that you might run into? If you can think of one, send it through in the chat. I know Jennifer, when she presented her flow, said there were a lot of barriers around the children. Maybe that's in your people category, getting your internet connection, the weather. Yes, those are great ones. How about any facilitators? I guess those could also be facilitators if your internet connection is great and the weather's great. Snow, yes. Good. So this is all we're going to kind of cover for the cause and effect diagram, but I wanted to let you know it's another tool like the process map that you can use to engage stakeholders and get to the root cause of a problem. So once you've collected all of your data and identified your factors, you'll want to map them back to that social ecological model that we talked about before. So here are some examples of factors that affect health outcomes related to the different SEM levels. On the individual level, it might just be someone's individual knowledge of the condition or the disease that is a factor related to the outcome. On the interpersonal level, it might be influence from family or friends. At the organizational level, maybe patient-centered philosophy or office systems that support the intervention. At the community level, things like availability of healthcare providers and resources. And at the policy level or the outer level, you might have things like health insurance reimbursement or laws regarding coverage for preventive health services. Then you also can map specific barriers the same way, like on the individual level, fear of getting positive results, etc. You guys can, look at this closer in your own time, but it's a nice tool to kind of lay everything out across the different levels of the SEM. And so while you can map barriers, you can also map the facilitators for screening. So you can take a look at those too. Let's see if we can add our time. Okay. So from all the data that you collected, you can start to establish your aims and objectives. And you should ask yourself some questions like, which of our patients have the lowest screening rates? And then what are those factors contributing to those low screening rates that we probably found in some of our stakeholder engagement activities and in our data search? And then which of those contributing factors are the most important and most changeable? And then we also want to assess what assets or resources do we have available to help us address the problem. So there's a few different techniques that you can use to help prioritize what you want to address. One is called nominal group technique, where you brainstorm with your stakeholders and your team to generate a list of of ideas and then anonymously rank them. Similar to that, you could go through rounds of multi-voting, where your stakeholders vote to narrow down a long list, and you continue doing that in different rounds until you get down to something that you have all agreed on or voted for. And then one of my favorites is the strategy grid, which is a matrix of two different scores that you're, two different scores for criteria that you're comparing. So it might be something like need and flexibility. So an example, if you were looking at health insurance in a matrix like this, there's a high need for health insurance. It would be a high impact change, but realistically, changing health insurance policy is not very feasible and it's hard to change. So that might be an example of something that you decide not to focus on and would instead look for something that is a little more feasible to change while still having a high impact. So those are just some tools you can use to prioritize where you want to focus. Next, you'll start to organize all those factors that you came up with by the SEM, and you can put them into like a map like this to create the start of a conceptual model. And this will be used to inform maybe a logic model for your program down the road and help you with future evaluation efforts as well. And so a lot more detail about how to create these types of models and evaluation will come in future trainings. So then once you have the first part of that conceptual model mapped out and you've prioritized where you want to intervene, you're ready to start creating your SMART aims and objectives. And so these are goals that should be specific, measurable, attainable, relevant, and time-based. So when you're thinking of your goal, you want to ask yourself things like, what's our target population? What's our desired outcome? How will our progress be measured and how will we know that we're successful? And then what's our time frame? So in other words, we want our goal to explain how much of what will be accomplished by when. So on my next slide, I have an example of a goal that's not very smart. Increase our patient CRC screening rates. What's missing here? What are some things that we could add to make this goal a little smarter? Yep, by when, I see in the chat, that's great. What else could we add to our goal? by how, by when, specific target groups, which method of screening, how much increase, ages, that's a good one. Yeah, those are all great. So here on my next slide, I have examples of ways you could reword that goal to make it a little smarter, like increase our African American patient CRC screening rates to 70% by December 2019. Or we will give a fit kit to at least 80% of our patients who are due for CRC screening by December 2019. I should change those dates. We're way past December 2019. Just noticed that. And then at least 50% of patients who receive a fit kit will return an accurately completed kit within 30 days. So now that we have our goals, that's where we're going to stop today. So we covered a lot. We talked about how to identify our current performance and create an assessment, and then use that to identify multi-level factors that contributed to our problem. We talked about creating process map and gap analyses to identify weak links in the process. And then we learned how to write our goals. So I just want to also plug that we'd love your feedback on our evaluation survey. I'll send it in the chat. It'll also go to your email inbox around 1 o'clock today. So it'll be great if we can get your feedback. All right, so there, I sent that into the chat. And then I just want to remind you all too of our trainings that are coming up. We have a couple-week break before we meet again on April 16th. And Dr. Jennifer Lehman will talk to us about how we can find and select evidence-based interventions that we can work to implement to reach the goals that we set today. So thank you everyone for participating, and we look forward to seeing you again on the 16th.